I want to start off by saying that the Healthy Caribbean Coalition's Get the Message campaign is the coolest thing that I've seen. Like, that is, it's amazing just what you've achieved. And it's, I mean, getting at a Rihanna concert, a video on NCDs up there, that's a fantastic achievement. And I want to start off by saying thank you to the, first of all, to my colleagues in the NCD Action team. Some of them are here today. Seema Shah, Carrie Tran, who's in the audience, and my colleague Sandeep, whose leadership has made this possible. And also to the Healthy Caribbean Coalition for bringing us here today and for this incredible learning opportunity. So my name is Philip Baker, and I've been chairing the NCD Action Network, which is a working group of the YPCDN. And today I wanted to talk to you about our experiences with establishing this website and this, what we consider to be the start of a social movement. We actually prepared a research paper for this event. We sourced case studies from 6 different NCD advocacy organisations. And we hope to share this research paper with you very shortly. That was prepared in conjunction with the Healthy Caribbean Coalition. So I'm going to introduce you to NCD Action Network, what it is, what we do and how we do it. I'm going to introduce you to some of our members. And then I'm going to introduce you to the millennial generation and what the implications of the millennials are for how we do advocacy. And then I'm going to talk about how we leverage social media going forward. So NCD Action Network was established in April of this year. And two of our colleagues, Ben Seligman and Nika Rapkin, came up with this idea and this question: is a social movement for NCDs possible? And can we start one amongst young people? We're reflecting on those lessons that were shared before about, the HIV/AIDS movement, the environmental movement. And we asked the question, is it possible to do the same for NCDs? And we asked the question, well, what's different between now and 2001 with the HIV AIDS summit? The social media wasn't around. So we saw this as the way to go forward and the way to do it. At the time, I didn't really know much about social media, but it's been a steep learning curve. So we got a team together, and in a matter of 6 weeks, we put together this website. We got a designer from Saatchi & Saatchi to do our branding for us, and it came together really well. At its essence and at its core, we took the idea that NCDs are and will continue to be a social justice issue. And this is a controversial idea, and it's actually a lot of people have debated this idea. But we've taken it because we believe the social justice messaging resonates with young people. And we've got research to show that. So the website itself functions as a blog site, and it links into our social media platforms. People can sign up easily. We also decided to provide resources such as training resources and education resources, so people can come to our sites. Not just for advocacy reasons, but to actually, we wanted to give some more value back to them. And the whole idea was about making taking action easy for people. So we had this initial idea of, putting letter templates online and ideas for advocacy onto the website. So the website gets about 2,000 unique visitors. Visitors every month. Half of those visitors are unique. It gets about 6,000 page views, and visitors spend about 4.5 minutes on the website. So it started in April 2011. So we think we are on the path to achieving something here. And it's really been possible to bring this all together by having a diverse team, a core working group of individuals. And the NCD Action Network team comes from 5 different countries. And so this whole thing has been put together over Skype and over email. And over, there's actually a project management system built in behind this website that has allowed this global collaboration to exist. The other aspect to this was partnership building. So Seema Shah has been our partnership and network networking lead person, and she's done a great job in engaging NCD advocacy organisations and getting them on board and working with them so that we can cross-promote our messaging and our ideas for action. So just to introduce you to our members. We've got 415 now, because 10 people joined yesterday from 58 countries. But you can see there from that map that, that Curry put together, that we now just have such a diversity of members. You know, from Bahrain, from Dakar in Bangladesh, from Peru. I mean, there aren't that. It's a truly global network. We initially decided to target young people, but I think it was the 10th person that joined the website was 78 years old. So, like, okay, well, let's just go with it. And you know, being young is we think now defined more by an attitude and by the willingness to engage with this type of advocacy and with the online community and with communicating in this way. So I wanted to drill down and just introduce you to three members that I think are kind of special. At the top there we have Shusmita Khan from Bangladesh, and she has been a truly nodal member for us, and she's taken on a leadership role within the NCD Action Network team. She's from Dakar in Bangladesh. She works for Eminence, which is an NCD organisation there, and she has become what we've called a storyteller. So she, her very first blog post was, and I think it was her very first blog post ever, was a story about this work that she's doing on the ground in Dakar. That she was asked this question by a young child: why doesn't the government shut the tobacco industry? And she was moved by this question, and she decided to share her answer on the NCD Action website. And that to me is compelling. She didn't just tell the story, she backed it up with data. She backed it up with her own research, her own epidemiological research. So it's this fusion of a compelling emotive story with the evidence. And I think that's how we can bring NCDs alive and make them real to people. We have connectors like Duncan Matheka from Kenya, who posted this blog: I want to find like-minded people in Kenya, students like me who want to start a local network, which now they're thinking might actually extend to Eastern Africa. So this is the power of social media. It connects people. I mean, we're not actually doing anything. This is just facilitated through our members. Thirdly is John-Paul Dussault from Benin. And he started a campaign, a policy dialogue platform called Golden Heart. Established on Facebook, he got a diversity of different people together, scientists, cardiologists, just a whole range of people, and started this Facebook policy dialogue platform. And he shared his experiences on NCD Action Network. And I think this is the power, the power of social media as well, that it can bring diverse people and diverse organizations together and generate this ongoing dialogue. So these individuals are examples of the millennials. Now, the millennial generation, by definition, are those born between 1978 and 1993. But as I've said before, I think it's come to us to mean more of an attitude. But they really are the first generation to grow, develop, and learn in a world of perpetual connectivity. And some of you might have read the work of Manuel Castells, a sociologist, who writes about this transition, this global transition to the informational network society, and just how youth are driving this, especially the continuing growth of mobile phone usage around the world. So what is it about this demographic that is important to advocacy, and what can we learn for our future advocacy efforts? Well, first of all, they're more likely to use ICTs and social media. ICTs and social media make activism more convenient. So in a world where we're swamped by information and we're time pressured, we're increasingly time pressured in our jobs and in our work, using social media is easy sometimes as a click. or sending a text message. And that's truly powerful. Millennials participate through social networks, so they tend to be more ambivalent about formal politics. So, if you look at voting, for example, in the United States by young people, it's been declining year after year after year. They tend to be more engaged instead with causes. So it's something that we need to think about. Lastly, social justice values resonate with young people. So those traditional values of public health, like equity and social justice, are something that resonates with young people. And we saw this in the Arab Spring uprisings, where you had young people who felt that there was an injustice. And they used social media to mobilize. I'm not saying that social media caused the Arab Spring uprisings. What I'm saying is they helped to facilitate it. So where there is injustice, social media can provide a platform for change. I'm not saying that the Arab Spring uprisings are applicable in scope and scale to the NCD movement. But there is injustice, as Sunny showed us. And we can harness this. We can take that messaging, fuse it with social networks, and create social change. The last point I'd like to make is that the age bracket of 15 to 22 is a window of civic identity. So this is the time period, it's a critical time period at which we can capture young people and plant the seed of an idea in their heads about not just about chronic diseases, but about public health generally. That what we're working towards is a more equitable society and one where health is a human right. So this is a critical time period, and we believe that capturing this demographic is essential to ongoing NCD advocacy efforts. So this is just some data from the research paper that we've prepared. As you can see here, since the beginning of the 21st century, ICTs have taken off, especially mobile phone subscriptions. And mobile phones offer an unprecedented platform for advocacy. And what's interesting is that this has been driven by youth. And Manuel Castells actually comments that what is developing is actually a mobile youth culture. We've all been sent a text message with garbled, abbreviated text words that make no sense. And that's what I'm talking about. It's reshaping human communication. So we're talking about a texting language, and in a way, a unique value system. And global social media platforms are diverse as well. But what we see here is the dominance of Google, of Facebook. And Facebook, since it was launched in 2004, and especially since 2008, has become by far and large the dominant social media platform. 750 million users. It's equivalent to the third largest country in the world. So, but as you can see, there are other platforms that are popular in other countries, and that has implications for advocacy as well. In the research paper that we prepared with the Healthy Caribbean Coalition, we wanted to draw case studies of organizations, NCD organizations, using social media and ICTs for change. And I'm just going to go through quickly some examples, but we've seen the power of the online petition, the Livestrong petition, the World Cancer Declaration with 500,000 signatures, the Partners in Health petition, the Diabetes Owers for Outrage postcard campaign, and the Women Demand a Healthy Future Free of Chronic Disease petition. And these have been sent out and through social media virally spread. And there's also Jamie Oliver's Food Revolution petition, which is, I think now it's hitting 750,000 signatures. So that's a lot of people. But this is the example that I wanted to provide, spend some time on, which is how social media and ICTs are really transforming health communication and health education. This is, I'm from New Zealand, but I live in Australia. And some friends of mine started this campaign called Hello Sunday Morning. And essentially it's a blog site. And it was started by this this guy Chris wanted to quit drinking, and his friends said, "You can't do it. Like, it's too much peer pressure." They said, "Well, you know what? I'm going to do it, and I'm going to blog about it. I'm going to write about it." All of a sudden, thousands of people were following his blog, and they decided to do the same thing. And so it created this sort of groundswell of people, and now 2,000 people are doing it. And what he's realized is that, after receiving $300,000 in grant funding to get this thing going, is that social media is transforming health communication. Individual interventions are expensive. They do have some efficacy. Population health campaigns are expensive too. They raise awareness, but they don't really create that much actual behavioral change. Social media kind of sits in the middle somewhere. It's personalizing these population health campaigns. It's creating a community of people that otherwise would not exist or could not exist. And so by creating a community, we're also creating accountability. You become, by participating in the community, accountable to it. And through identifying with each other's blog posts, you're generating new cultural norms and new cultural values about what it means to drink. I should have mentioned that we have a terrible drinking culture in Australia and New Zealand. So this to me is amazing. And this is the way that social media is transforming health education. Lastly, I wanted to comment on the last example I'll give is Jean-Paul's example of the Facebook policy dialogue platform in Benin. It now has more than 1,000 members, and it's going strong. It was established earlier this year, and it's just a fantastic initiative. So finally, I'd just like to say that we believe young people represent an unprecedented opportunity for NCD advocacy. NCDs are not going to go away anytime soon. We're talking about a decades-long problem. So we need to think strategically, and we need to think long-term about advocacy. And this is where capturing that civic identity, that window of hope that young people represent, is going to become, or is incredibly important. So we'd like to continue to learn from the organizations represented here. And I think Chris's final points in his presentation say it all. That if we work together, we work towards generating our own brand, we're united in messaging, and if we can work together towards this common goal of agitating, advocating for NCDs, we can go a long way. So thank you.